This is the intrathecal pump, and we are planning a refill for this. So clinically we have to first feel the pump, and at the center of the pump you can feel the refill port, which is made of silicone. So it is felt as a distinct depression. We will be palpating it and piercing it with a scalp. So this is a 22 gauge scalp. We can pierce it with either a 20 or 22 gauge scalp. Up to 400 piercings are allowed. Okay, so when you palpate the pump, a distinct elevation is felt at one end, which is called as the catheter port. So this port is important if we want to flush it in case of any blockage for troubleshooting. Also, if we want to visualize it under C-arm, we can inject the dye through this port so that the pump will be visualized. Not the pump, the catheter will be visualized. What is that? In line with the catheter port, we can feel the reservoir port, which is felt as a dimple in the middle of the pump, which helps to communicate the tablet along with the patient's pump. So this we are going to place in contact with the pump. It will be directly over the pump. Be maintained throughout the programming.
Now it shows communication in progress.
It is already occurred, that's why it's showing that the potential underdose, there are chances, you have to check. 2 mg, it will remain same 2 mg per ml, 2 mg per ml. Next, reservoir volume is 40 now, we just refilled it. Next, confirm the dose 2.7. So do you want to?
So we are adjusting the dose as 3 mg per day.
7.1% increase. So while updating the last step, while updating the parameters, the pump the communication should not break between the programmer and the pump. If it if it breaks, pump goes automatically under shutdown. And again you have to communicate. As soon as you communicate again, pump automatically starts.
It should not be shut down for more than
20 minutes.
What if it shut down for more than 20 minutes?
Permanent shutdown.
Okay, so if pump shuts down for more than 20 minutes, it's a permanent shutdown. So please tell about the MRI. You said the pump should not be stopped for more than 20 minutes, or else it is a permanent shutdown. What about MRI?
While the patient is under MRI, first the pump is compatible with both 3 Tesla and 1.5 Tesla. There may be patient may feel pulling or something like that. We have to just bind with elastic so that pump doesn't move. And when patient goes under MRI, pump automatically shuts off at that duration. That's why it should not, the sequencing should not exceed 30 minutes. It should be below 30 minutes. And when a patient comes out of the MRI, it may take the rotor, the pump start within 20 minutes, or it may take 24 hours.
Okay. While doing the MRI, do we need a reprogramming, or we can directly send the patient?
No, we have to check if there is any change in parameters or not.
So if I ask an MRI to the patient, then we need to inform to you as well, and you will come check the XYZ parameters onto that, whether pump is working normally, and then we'll send it to the MRI. We as a doctor cannot send directly to the MRI without informing the company, right?